Hi, everybody. This is Lee, and I'm talking about the H.R. 676 House Bill by John Conyers, the Expanded and Improved Medicare for All Act. And I'm talking about that because in my ramblings around the old internet and interacting with folks, I find that people have opinions on it. They have propaganda on it. They have sloganeering and, things like that on it, but without really knowing the text. And I know that because they make accusations that are actually covered by this act. It's very comprehensive. It covers a multitude of issues. And so I'm going to basically give a bedtime story, the expanded and improved Medicare for All Act bedtime story. I am going to read through it, the summary, not the full text, because that'll be all day. So I'm going to read the summary and then give my opinion. And therefore, maybe people can put this on repeat and kind of absorb the information. And this is important. So if you are in a debate, or if you're trying to lobby someone like your congressman or your next door neighbor, you have answers to questions. So I am going to read through it. And let's see. Okay. Expanded and Improved Medicare for All Act by John Conyers. It was introduced in the House January 24th. At my last look, it had up to like high 70s co-sponsors, people who are willing to express support for the bill and assist with lobbying for it, and then indicating that their votes will be yes, increasing the likelihood that it will be sent to the floor if there's enough votes, or it looks like there's enough votes. And so this has been introduced in session after session. Thankfully, with Bernie Sanders commenting on the concept of healthcare as a right, universal healthcare, Medicare for all even, it's getting more attention, and more people are signing on, including Tulsi Gabbard. I'd asked about that before because I was very puzzled by the fact that her home state of Hawaii had a single payer bill going through the Hawaii state legislature. So obviously her home district, or her home state, has interest in single payer, and you would think that she would sign on to the federal version of a single payer bill, if that's what her district seems to be supporting. And so she has. And so it's getting more attention. The words are getting out there. People are no longer concerned with, or so much with, defending Obamacare or the Affordable Care Act, now that the Affordable Health Care Act, AHCA, has been defeated and Obamacare is apparently safe for now. Now it's time to turn focus to actually advocating for Medicare for all. Healthcare as a right. Healthcare is a public good. Healthcare that's universal. Everyone is in. No one is left out. Everyone is entitled to care. Okay, and so I'm going to go through the summary and hopefully answer a few questions, and then put a link in the description to the actual bill, and then people can get the full text and see the actions behind it. It's been sent to several committees already. It seems to be stuck in the Natural Resources Committee since early February, and I hope it hasn't been sent there to die. But we'll see what happens. Hopefully good things only. Okay, so the bedtime story is about to begin. Expanded and Improved Medicare for All Act, H.R. 676. This bill establishes the Medicare for All program to provide all individuals residing in the United States and U.S. territories with free health care that includes all medically necessary care, such as primary care and prevention, dietary and nutritional therapies, prescription drugs, emergency care, long-term care, mental health services, dental services, and vision care. And so right now we have people in Libby, Montana that certain districts in the state of Montana who have Medicare for All, they are already enjoying the benefits of this. People who are covered regardless of age, that the age limit has been, or mandate has been eliminated for them because of the previous asbestos poisoning that they suffered. And I have said that I do believe that the people of Flint, Michigan, are entitled to the same caretaking as the people in Libby, Montana, for the poisoning that they received as a direct result of governmental incompetence and possibly criminality. And so that would be my recommendation. And so if people have real questions and concerns about Medicare for All, if you have access to people in Libby, Montana, or you know them, I would say maybe question them on whether they're ready to give that up for something else that Rand Paul or someone can come up with. I can't speak for anyone, but I would doubt that they would trade Medicare for All to a for-profit insurance package rather than healthcare package. Okay, so I'm going to continue. Only public or nonprofit institutions may participate. Nonprofit health maintenance organizations, HMOs, that deliver care in their own facilities may participate. This means that the insurance companies are excluded from replicating service. And I'm going to go forward. Patients may choose from participating physicians and institutions. Health insurers may not sell health insurance that duplicates the benefits provided under this bill. Insurers may sell benefits that are not medically necessary, such as cosmetic surgery benefits. And so that would be the new role of the health insurance industry, that they would be supplemental, extra elective type coverage for elective care that's not required or necessary for basic maintenance of chronic conditions or preventative treatments or things like that. And so the bill sets forth methods to pay institutional providers and health professionals for services. Financial incentives between HMOs and physicians based on utilization are prohibited, and so that's a regulatory aspect of this bill. The program is funded, 1, from existing sources of government revenues for health care, 2, by increasing personal income taxes on the top 5% of income earners, 3, by instituting a progressive excise tax on payroll and self-employment income, 4, by instituting a tax on unearned income, and by 5, instituting a tax on stock and bond transactions. Amounts that would have been approved for federal public health care programs, including Medicare, Medicaid, and the Children's Health Insurance Program, CHIP, are transferred and appropriated to carry out this bill. And so that's how the program is funded. Everyone pays in from payroll or self-employment or unearned income, and that the top 5% are required to pay their fair share of taxes, and then also a transaction tax on Wall Street. And then all the government funding that's going into other programs, other healthcare programs, would be transferred into this bill, this Medicare for All. So everyone gets the benefit of that. You know, money that's already being allocated towards those programs would be transferred in. And so that's how the bill is paid for. I got lots of questions about that, and I hope that answers it. See John Conyers if you have further concerns. The program must give employment transition benefits and first priority in retraining and job placement to individuals whose jobs are eliminated due to reduced clerical and administrative work under this bill. And so there is a fear that because a lot of the insurance money that's paid now in the form of premiums, monthly premiums that are deducted from people's checks or that they pay in. The deductible that must be met, co-pays, sometimes out-of-pocket expenses. A lot of that goes into a layer of operation and administrative costs rather than to actual caretaking of patients, rather than to actual doctors, nurses, and hospitals. It goes into funding an industry. It's a form of corporate welfare, and it's a form of transferring wealth from the 99% upward to the 1%, the corporate oligarchy, that are kind of hosing up a lot of money and then not providing sufficient care and services for the amount of money that they're paid. And this is putting a stop to that. Money will go where it's supposed to. This means that there's going to be layoffs, that people who are being paid that are not necessary underneath the Expanded and Improved Medicare for All Act, they may be required to have retraining and have first priority to positions maybe paid for as a form of government service to run this new program. And so there may be some job loss, but that would be because there's a lot of money going in to operation costs, and part of that is employment of clerks and bills and coders and people who work in that aspect of the insurance industry, the health insurance industry, which has exploded underneath the ACA, the Obamacare. There's been an explosion in like health clinics and health related businesses everywhere, and that's because we the taxpayers are funding that. And so there needs to be a transition, a reallocation of funding. And so those who are experiencing the need to transition from one type of employment to another, this bill takes care of them, provides for them. The Department of Health and Human Services must create a confidential electronic patient record system. The bill establishes a National Board of Universal Quality and Access to provide advice on quality, access, and affordability. The Indian Health Service must be integrated into the program after 5 years. Congress must evaluate the continued independence of Department of Veteran Affairs health programs. And so that might be why it's in the Natural Resources Committee that the Indian Health Service must be integrated into the program, and maybe they're trying to figure out a way to do that. I hope that there's actually work being done and that the bill is just not being held and mothballed there. And then interestingly enough, that the Department of Veteran Affairs, their health program, excuse me, may be folded in. It looks like Congress is going to be evaluating that. And so I hope the summary of the bill and my reading of it and my opinionating on it is helpful and provides an extra layer of illumination. I feel that it's good. It's a good bill. I think it's highly advised if you speak to people about it that you are able to answer basic concerns, the real concerns that people have. And then also address a lot of the propaganda that the insurance industry, the health insurance industry, has a vested financial interest in protecting itself. Which means that they have a vested interest in killing this bill and will say anything and do anything and use their puppets that they have paid for in Congress to actually assist them with killing the bill. And I named who those Congress people were in a previous video, that they've received millions of dollars from the health insurance industry, and therefore are willing to be public servants to the health insurance industry rather than to the people that they're supposed to be representing. And that you may hear pushback from the servants of the health insurance industry, that business, for-profit insurance industry that lives on our tax money, whether we like it or not. But you have knowledge. Knowledge is power, and then that's how you fight propaganda, by establishing your own narrative. Good luck.